For decades, alcohol has been part of the culture. A glass of wine to unwind. A beer with friends. A toast at a wedding. Most people would tell you, in moderation, it's harmless. Maybe even healthy. But now, the World Health Organization has dropped a statement that's turning that belief on its head. According to a team of WHO researchers, no amount of alcohol is safe. Let that sink in. Not one glass. Not one pint. Not even an occasional celebratory sip. In their latest comment, published in The Lancet Public Health, WHO experts argue that even moderate drinking may come with serious health risks, and that any so-called benefits of alcohol are significantly outweighed by its harms. Their words are bold. As such, no safe amount of alcohol consumption for cancers and health can be established. This warning comes as millions take part in dry January, swearing off alcohol after a holiday season of indulgence. But it also comes with sharp criticism from many in the scientific community and beyond, some accusing the WHO of fearmongering, others of oversimplifying a far more complex issue. So, who's right? Is even one drink too many? Let's break it down. The WHO's argument first. Here's what the WHO is saying. Alcohol is a leading risk factor for premature death and disability, especially among younger people. According to their estimates, excessive alcohol consumption kills 3 million people globally each year. Beyond liver disease and addiction, alcohol has now been linked to several types of cancer, including liver, breast, esophageal, and colorectal cancer. The WHO claims that even small amounts of alcohol carry a risk, particularly when it comes to cancer development. Yes, they acknowledge that some past studies suggest small amounts of alcohol may be associated with a reduced risk of heart disease or type 2 diabetes. But they argue that those benefits don't apply across the board, and disappear entirely when heavy episodic drinking enters the picture, something extremely common in weekend social culture. And let's not forget, much of that older research was observational, meaning it showed correlations, not causes. Confounding factors like lifestyle, diet, income, and even social relationships could have influenced the results. So according to the WHO, there's no proven safe threshold. Their recommendation? Be fully transparent with the public. Any alcohol consumption carries risk. The backlash: not everyone is raising their glass to this warning. Critics argue that the WHO's statement is alarmist, lacking new data, and paints alcohol with too broad a brush. Christopher Snowdon, head of lifestyle economics at the Institute of Economic Affairs, says the evidence on moderate drinking is clear, and overwhelmingly in favor of small amounts being not just safe, but potentially beneficial. He points out decades of research suggesting that moderate drinkers may have a lower risk of heart disease, stroke, dementia, and even longer lifespans compared to non-drinkers. He goes as far as saying, if moderate drinking is risky enough to worry about, the risks of not drinking at all must be terrifying. So who do we believe? What the guidelines actually say. Let's not forget, national guidelines are still more balanced and less extreme than the WHO's latest comment. In the UK, the NHS recommends no more than 14 units of alcohol per week. That's roughly 6 pints of beer or a bottle and a half of wine. Spread it out over 3 or more days, and avoid binging. In the US, the Centers for Disease Control and Prevention, CDC, advises that men limit themselves to 14 drinks per week and women to 7. These recommendations don't suggest complete abstinence, just moderation. Experts like Ian Hamilton, an addiction specialist at the University of York, say the WHO's warning is technically accurate, but needs nuance. Sure, there's no safe level, but the actual health risk for low-level, occasional drinkers is very small. The real danger lies with excessive and chronic drinking, and especially binge drinking. What we're really talking about here, this debate isn't just about wine or whiskey. It's about how we communicate risk, especially when it comes to things we've normalized, like alcohol. There's a difference between saying no amount is safe and saying moderation carries very low risk. And how that message is framed can affect how people respond, especially younger generations who are already rethinking their relationship with alcohol. Dry January, sober curiosity, non-alcoholic spirits and mocktails are booming. Gen Z is drinking less than any generation before them, not because of warnings, but because they're choosing mindfulness, health, and clarity over hangovers. So in a way, the WHO's message, even if blunt, may be arriving at the right time. We're already shifting. They're just putting a spotlight on the science behind it. So, should you stop drinking? That's up to you. If you drink occasionally and stay within recommended limits, most health experts agree, your personal risk is low. But if you drink heavily, regularly, or binge, especially without being aware of how much you're really consuming, the risks add up fast: cancer, liver disease, high blood pressure, mental health struggles, and more. The WHO isn't saying you must quit. They're saying you deserve to be fully informed. Final thoughts: alcohol has long been tied to celebration, culture, connection. But science is catching up to the consequences, and what we're learning isn't always easy to hear. Whether you choose to keep drinking, cut back, or quit entirely, one thing is clear: the conversation around alcohol is changing. And maybe that's the healthiest thing of all. This for watching the Avoice podcast new channel. Please subscribe to the channel, we appreciate your support. See you in the next video.